Several hospitals are once again feeling the pinch of an increase in COVID-19 cases, possibly driven by the Delta COVID variant. Let's talk about this and the situation in hospitals some more with Health Undersecretary Leopoldo Vega, who joins us over the phone. Good evening, Usec Vega. What is the real score in hospitals right now? Have you received any reports of hospitals getting overwhelmed? And if so, where are these hospitals located?
John, good afternoon to all and to all to the listeners today. If you are looking at the perspective of the healthcare utilization in NCR, you'd see that we have steadily increased in the number of patients coming in, and HUR right now it's still in the low risk position, but we are gradually increasing in terms of the ICU utilization, which is now between 53 to 54%. 2 weeks ago, this was only about 43%. And it has gradually increased to 47% and to the present, which is roughly about 53 to 54%. So in other words, we're seeing a steady increase in the number of cases here in Metro Manila, and this is also relevant in terms of the number of cases that we have. Here in the NCR, we have noticed also that there is an increase in the number of new cases and active cases. And for the last 2 weeks ago, we were just having an average of almost 600 plus new cases, but gradually it has increased, and at this present day, it has reached about 2,000 cases here in Metro Manila, or 26% of the total 8,000 that has been generated as new cases. So we are seeing really a steady increase in Luzon, and then this is a very steep increase compared with Visayas, wherein there is also a slight increase in the number of new cases.
All right, and this is across the board with either or both public and private hospitals, you said?
You're coming in choppy, Sean. You're coming in choppy. I didn't quite get you.
All right. Is this the case for both private and public hospitals across Luzon?
I didn't get you. I'm sorry. You're coming in very choppy.
All right.
Sorry.
Can you hear me okay right now? Sir? Usec? All right, I will try to get back to Usec Vega in just a bit. At least seems like we have lost that connection. We'll try to fix that. But in other news, Metro Manila mayors have agreed to implement unified curfew hours starting Friday, August 6. MMDA Chairman Benhur Abalos said that unauthorized persons will not be allowed to go out between 8 p.m. to 4 a.m. during the 2-week ECQ period. Aside from the curfew policy, authorities will also prohibit indoor and outdoor dining, while takeout and delivery services will continue. Personal care services, entertainment venues, and tourist attractions will all be closed during ECQ. The IATF says that the liquor ban will be upon the discretion of concerned LGUs. Also during the ECQ period, only residents aged 16 to 65 will be allowed to go outside. Religious gatherings have to be held online. And as for wakes and funerals of non-COVID cases, only immediate family members will be allowed to attend. All right, and as promised, we have Health Undersecretary Leopoldo Vega back on the line. Usec, hi, can you hear me better this time around?
Yeah, I can hear you better, Son.
Right. So I was asking about the hospitalization rates, if the rising cases and rising utilization rates for hospitals and ICUs are for both public and private healthcare facilities?
Yeah, generally the HUR for both public and private here in Metro Manila is in the low risk position, but with the ICU utilization, it's steadily going up. It means that there are areas here in Metro Manila like Quezon City and Muntinlupa and part of Makati, wherein we see a moderate risk position for the healthcare utilization.
Right. Of course, one of the things that we had from the last surge back in March and April was the One Hospital Command Center, USEC. How is it going with the One Hospital Command Center? Are you starting to receive more calls now?
Yes, we have noticed that since 2 weeks ago, we have just been receiving almost 90 to 110 average of calls per day. But with the number of new cases getting into the picture, it means that we have more calls. So we have an average of about 175 to 180 calls per day now. So there's really a steady increase in the number of calls, which is also in relation to the number of new cases that we see here in Metro Manila.
Right. Usec, I have to ask you this. We saw what happened in India. Can hospitals here handle a Delta-driven surge? Given the limited resources and manpower, was the last few months enough time to prepare for Delta?
Yeah, I think the action of the IATF in putting Metro Manila and some of the areas in the Philippines in ECQ is really to prevent what happened to the other countries. I think with proper and aggressive prevention and isolation and, of course, the contact tracing and testing of these patients at once in less than 48 hours, we can be pretty sure that the transmission will be very low. This is really one way of stopping the transmission, of making sure that there is less mobility and there are less super spreader events that are happening. And the second thing is there should also be a ramp up of the vaccination. And as you can see, the vaccination has been ramping up because this is another pillar wherein we can have a better protection for our community. So both prevention and vaccination will actually be the main strategies really for keeping this COVID Delta variant at bay.
All right. Thank you so much for your time. That was Health Undersecretary Leopoldo Vega over the phone. Thank you so much for your time, USEC. We're going to pause for a quick break, but we will be back with more stories after that. Keep it here.